In the next section of the exam, you will remove the skin and expose the neck and coelomic cavity. To remove the skin, place the bird in dorsal recumbency. Tent the skin between the end of the keel and the vent, and use a sharp blade or scissors to make a small incision through the cutaneous tissue. Gently begin pulling the skin laterally. A good technique is to elevate the skin to create tension and use your fingers to pull it away from the underlying tissue. In a young bird or a fresh bird, the skin is easily removed. In a mature bird, a water bird, or a bird that has undergone autolysis, it's harder to separate the skin from the subcutaneous tissue. It's important to perform this procedure carefully to avoid penetrating the body cavities, as this could contaminate the tissues and compromise laboratory testing. To skin the neck region, make a shallow incision up the left side of the neck. Gently peel the skin back, working from left to right. Take care to protect the esophagus, crop, trachea, thymic lobes, and vagal nerves, which are all tightly adhered to the overlying skin. Continue blunt tissue dissection until the entire ventrum of the bird is exposed from beak to legs. To help the bird lay flat for the remainder of the exam, you can dislocate the femurs. Place your thumb over the ventral aspect of the femur and brace your remaining fingers on the dorsal synsacrum. Firmly rotate the femoral heads upward and outward until the femurs dislocate from the acetabulum. Free up any remaining soft tissues to allow the bird to lay flat. Examine the chest region. With the keel exposed, reassess the shape and symmetry of the keel, looking for abnormal deviations or curvature. These findings may indicate management problems such as vitamin or mineral deficiencies. The pectoral muscles can be examined for lesions at this time. Make a series of parallel incisions through the muscle bellies, looking for areas of necrosis, inflammation, or hemorrhage. The pectoral muscles can also be removed from the keel and ribs and examined in a similar manner. Removing the muscles may make it easier for you to visualize the anatomic landmarks you will need to remove the ribs later in the exam. The body wall of the bird is very thin. When compared to the level of the keel, the body wall should be flat or concave. Note any bulging, which could indicate the presence of fluid in the coelomic cavity. If the bird is in good body condition, the peritoneum may enclose a thick layer of fat in the posthepatic septum. Grasp the body wall on the midline, tent the tissue, and make a small incision. Extend the incision along the keel and down both sides of the body wall. With the body wall removed, make an initial assessment of the caudal coelom. Lift the keel and examine the air sacs. The air sacs are thin membranes distributed throughout the body. However, they are often easiest to visualize beneath the keel and along the ribs. In a fresh, healthy bird, air sacs should be transparent, but the membranes will become slightly cloudy after death. In overconditioned birds, fat may be present on the membranes. Inflammation of the air sacs can result in thickened membranes, opacities, or fibrin deposition. Be on the lookout for any accumulation of fluid, foam, or exudate. Before continuing the necropsy, determine if any bacterial cultures or other samples need to be collected from the coelomic cavity at this time. Keep in mind that the tissues will be least contaminated at this stage in the exam. To expose the cranial coelomic cavity, you will remove the sternal ribs and keel. If the pectoral muscles have been left in place, you can make a shallow incision along the surface of the muscle to mark a path for the shears. Then insert the poultry shears under the ribs and cut along the costochondral junctions, moving from bottom to top. At the thoracic inlet, turn the shears medially and cut the coracoid and furcula. Lift the keel and cut any remaining soft tissue attachments over the heart. As you remove the rib plate and keel, be careful to avoid tearing the crop. When done correctly, this technique produces good tissue exposure while minimizing any tissue damage. Finally, to fully expose the coelomic viscera, remove any fat and peritoneal tissue covering the coelomic cavity. To avoid accidental organ penetration, elevate the adipose tissue and use the scalpel to cut away from the organs.